It's better vision for life with board-certified ophthalmologist Dr. James Kelly.
So LASIK is one of today's greatest success stories. It's been around for decades, well established. It's got a great safety record, brings vision to so many people, and sometimes greater than 20/20. So we're going to talk about that today because there's a lot of misconceptions about LASIK, myths and facts. Dr. James Kelly, board-certified ophthalmologist, joins us today. How are you today, Dr. Kelly?
Steve, thank you for having me. I'm doing really well.
I'm looking forward to debunking some of these myths and getting the facts out there. Are you ready for the first one?
I'm ready.
Okay. LASIK is painful or dangerous, myth or fact?
Well, every procedure has some risk associated with it. The safety and track record of LASIK is almost unparalleled in the history of human medicine.
Myth or fact? I'll never need glasses, or I'll still need glasses.
For almost everyone that has LASIK, they will never need glasses or contacts to see far away again. But as they age, they'll naturally undergo this aging process and need glasses for reading.
Okay, what about this one? LASIK results can eventually wear off. Myth or fact?
Well, it is a fact. That is a fact. So some patients lose a little bit of the effect of LASIK, and we may have to go back and do a little adjustment. But for the vast majority of patients, it's done once in a lifetime. And we monitor those people that need that second procedure. So it is a fact.
Okay, what about this one? LASIK results wear off after time. Myth or fact?
Well, it really is more of a myth, but what happens is some patients, their eyes will change over time. So LASIK corrects whatever the prescription was at that moment in time, but the eye is a living organ that changes over time. So rather than thinking of it as the LASIK wearing off, it's their eyes change and they need an updated prescription or an enhancement procedure.
I'm really curious about this one because everybody's shopping around, everybody's looking, no matter if you're going to buy something or look for a service. The cheapest LASIK eye surgery is no different than the most expensive one. Myth or fact?
That's a total myth. So there is a certain investment that has to be made in the technology and the staff and the equipment that we pass some of that cost on to the patient. So shopping for the cheapest LASIK is not always a good idea. I could tell you that. I work on a lot of patients who've gone to places based on price, and I have to do some more work on them.
I've heard this one from a lot of people. The laser that's used for LASIK can burn your eyes. Myth or fact?
That's a myth. So it's a non-thermal laser. So the laser doesn't work by burning the eye. The laser works by placing light energy to reshape the eye. So it's called photoablation. So that's the process that we use to correct vision.
We're doing LASIK, myth or fact with Dr. James Kelly. All right, how about this one? LASIK is painful, myth or fact?
Well, it's a little bit of both. During the surgery, there's a little bit of discomfort, but for the first 5 hours after surgery, there's a significant amount of discomfort, but then that discomfort goes away. I tell patients for a lifetime of good vision, it's a relatively small amount of pain overall.
What about this one? LASIK is exclusively used to treat nearsighted patients. Myth or fact?
That is a myth, Steve. So LASIK is used to treat nearsightedness, astigmatism, and farsightedness. And we've had these approvals from the FDA for many, many years, going back to the 1990s, actually. And we're in 2022 now.
It can take a long time to recover from LASIK. Myth or fact?
For the majority of people, that is a myth. Most people resume their normal activities after 24 hours. There are some patients that have slightly longer healing, but for the vast majority of patients, they are seeing well within 24 hours.
We're with board-certified ophthalmologist Dr. James Kelly. LASIK, myth or fact? What about you can be too old for LASIK, myth or fact?
That is that's a little controversial there because, and I say this because if you have other eye diseases that come along with getting older, you would not be a candidate for LASIK. So that is a fact that you would not be a candidate for LASIK if you had other eye diseases like glaucoma or diabetes or cataracts of macular degeneration, which many people will be afflicted with as they get older. So not everyone's a candidate. Yep, that's true.
By the way, we didn't rehearse these. I'm just throwing them out to you and getting the answers that I think people are asking. What about everybody can get LASIK, myth or fact?
That is a myth. Everyone can't get it. Just like we were saying, if you have underlying eye conditions, depending on what those conditions are, many people are not candidates for LASIK. And I unfortunately have to tell some of these people that unfortunate news face to face when they come in for a consultation. And we try to do this only on people that are appropriate candidates.
LASIK uses blades to cut your eyes. Myth or fact?
That is currently a myth. I haven't used a blade on a person's eye to do LASIK in about 20 years now. In the early days of LASIK in the 1990s, we did use a blade because that was the best technology. And since the early 2000s, it's been done all with, in my hands, with a laser only. So there's no blades, no scalpels at all.
All right, we got one final one. Here we go. LASIK is very expensive. Myth or fact?
Well, when you look at the cost of contact lenses and glasses over a lifetime, it's actually, in many cases, much less expensive to have LASIK. Plus, we have financing plans often with 0% interest that we make an amount that can fit into most people's budgets. So I would say that is a myth.
I think we just created LASIK Mythbusters right here.
We did.
Remember the TV show Mythbusters? I think we just did that. Remember the TV show Mythbusters? I think we just did that. Dr. Kelly, thank you very much for debunking some of those myths and bringing the facts to light.
It's my pleasure, Steve. Nice to be here.
It's better vision for life with board-certified ophthalmologist Dr. James Kelly.
Learn more at kellylaser.com.